have a very interesting topic. The topic is unhappy patients and how to get them from unhappy to happy. Okay. So again, we taught ophthalmology, we taught anatomy, we taught surgical skills, everything. But nobody has ever taught us how to handle an angry patient. We can handle angry children, we can handle angry spouses, but angry patient, unhappy patient is a different ball game. So I guess I'll be trying to skim through this interesting topic, and coincidentally, I am the agony aunt in my organization for these angry patients, and I see my fellow colleagues smiling at that. कोई भी गुस्सा पेशेंट होता है बोले आप ई ब्लॉक में डॉक्टर कपूर के पास जाइएगा. So how do I do that, and how do I train my fellow colleagues to handle angry patients is something very interesting. It's a very interesting journey. And this is the core. You know, when I was actually studying and planning for this topic, I actually thought about what are the topics which we are not taught about. And this seemed to be a very interesting topic. You know, when we come to practice, as my friend Dr. Mathur said, you know, it's like we are given teeth and claws to hunt, but does anybody teach us to hunt? Hunting, don't take it in a bad manner, but that's our livelihood. We are not taught that. So most common situation is surgeon is happy, patient is happy, best case scenario. Surgeon unhappy, patient happy. Fantastic, no problems. Surgeon is happy, patient is unhappy. Now this is tricky. Everything is okay from your side, patient is not happy. What are the reasons for that unhappiness? How to address them? How to have an organogram? How to manage that? Surgeon unhappy, patient unhappy. This is another worst case scenario. So let's first of all accept the outlook of the patient has changed. Everybody wants to be a winner. Have you realized how parents are sending their children to guitar, Bharatnatyam, swimming pool, karate, taekwondo, mountain climbing, cycle racing? Parents want their children to know everything and be best at that. That's what the society is doing to us. So the patients want nothing but the best. And he feels he should be the bestest patient with the bestest clinical results ever in any textbook. So what do you have to do? You have to learn to evolve. Evolve in your emotions, evolve in your approach to the patient, evolve the way you market yourself, evolve the way your team crisis handling is done by your team, your managers, how do they handle it? So as it is said, you know, the survival of the fittest, the Darwinian survival of the fittest is not the strongest, the fastest, or the smartest. It is the most adaptable. That is what Darwin meant, I think, in my opinion. So how will we survive this era? By adapting our means of talking to the patient, counseling them, the way we do internal marketing, the way we approach them, the way we handle their emotions. Gone are the days when, you know, as Dr. Mathur said, you know, doctor was Bhagwan. Whatever you say is the final word. That's not there anymore. There is one way to grow, only one way. Patient's fulfillments, visual fulfillments, aspirational fulfillments, which means the patient should be able to say, I got operated at the Jim Corbett or high-tech eye clinic. You know, that's aspirational. That should be the power of your brand and your team. He can get surgery done anywhere. But if he can say, I got operated at Visitech, and the name should have power. I got operated at Sharpsight. That name should have power. So that's an aspirational niche you have to create for your practice. It could be a small or a big city you're staying in. Make sure that your staff sends back the patient with that feeling that he has come to the right place and there could not be a better choice than that. The moment you do that, there is no way but you're growing. So the change is the only constant. There is a paradigm shift in the way patients are approaching practices. They are doing Googles, they are seeing your reviews, they are seeing your opinions about your clinic. So everything is changing. So we also have to adapt to that change. In case there is a bad review on social media, you should have a team trying to address it, trying to talk to the patient, trying to get the patient to change it. I can very proudly say, Dr. Vineet might have shown, we at Sharpsight have more than 65,000 65,000 organic reviews and we rate 4.9. That is the power of IT. 65,000 reviews with a rating of, the moment we go below 4.8, my IT team gets cracking. They call the patients with bad reviews, they talk to them, they visit them, complaint redressal is done, and they made sure that the reviews change back again. And a lot of times with an edit. Okay, I think I was wrong in my opinion. This is my opinion about SharpSet. So this is what your aim should be. So when you create an environment of positivity around your brand, the chances of having an unhappy patient are less. So sometimes it could be such a small thing that the patient could just feel that he's been overcharged for the service he's got, and he starts getting unhappy. That's where the cycle starts. Something simple, increased waiting time than expected. The unhappiness starts. So we should have check mechanisms. If the patient is waiting for long, there should be a floor manager, goes to the patient, says, sorry sir, your waiting was 45 minutes. You were supposed to see the doctor, but this is an issue. There'll be another 20 minutes. Meanwhile, can I have you have some coffee? This one sentence takes the unhappiness away. But if you have a patient who's waiting for 1.5 to 2 hours, he's very happy with the surgery, but now he starts looking for faults in the surgery because he's unhappy. Doctor Saab, this happened, Doctor Saab, that happened. And the cycle of unhappiness starts. So start nipping unhappiness in the bud. Patient waiting area, confusions, miscommunications. So missed communication, a lot of times patient will get a monofocal lens, but he sees the next guy reading a book and he'll feel he's cheated. There's a missed communication. Probably he was not explained properly and the unhappiness starts. So you have to talk to the patient, understand why is he unhappy. The best way to redress a problem is ask the patient, how do you think we can help you? And you will be surprised. Most patients will give the solution themselves. Something simple. Dr. Kapur, next time I come, please promise I don't have to wait. So I'll say priority. So next time I call the front desk and say this patient comes priority, I call in front of the patient. And I tell them that the patient has to be red flag, no waiting. And the unhappiness is gone. Sometimes the patient says, Dr. Kapur, this happened. I think I was overcharged for this investigation. Try and explain. And next time you can say, okay, we throw in some discount for your relative he comes in. So try readdressing the problems. So miscommunication is something very interesting I want to share. I had a patient with toric astigmatism. I put in a 3 diopters of toric lens. Something happened. I think there was a calculation issue. After 2 weeks, the son who works in a corporate comes with his mother and says, Dr. Saab, my mother is very unhappy. So I look at the EMR sheet and I see, wow, 4 diopters of astigmatism still there. And I said, I'm in for trouble because, he's going to grill me कि आपने toric lens डाला, ये सब. So I'm talking about miscommunication and listening to the patient carefully. So Abhi, I'm just swallowing my fear. What should I say? I need to take the patient back to the OT, explant the lens, rotate the lens. But common sense. I said, माँ जी आपके बेटे कह रहे हैं आप परेशान हैं, क्या problem है? You know what she said? Doctor साहब बहुत रड़क होती है. And I was thinking that he's going to kill me, that he's paid a fortune for a premium lens and there is a 4 diopter of cylinder. So the power of questioning and listening. So if you question the patient, most often you'll know what to speak. So a lot of times we address the patient's problem from our fears. Ask the patient, what is the problem? Address, have a direct question. And most often, you should always have an approach. Walk to the patient, smile, shake hand, stand straight, look in the eye, communicate. When the patient is speaking, don't interrupt. Let them speak. The best thing which works with elderly people is, once they've spoken, repeat it. Doctor साहब, आँख में पानी आता है, खुजली है, दवाई डालती हूँ, रड़क होती है. 4 things, and you say, okay माँ, आपने क्या बोला? आँख में पानी आता है, खुजली होती है. And then they say, wow. Because घर में, nobody probably listens to these people. So when you repeat the complaints, she says this is the best doctor because he even narrated the complaints in the same order. And then approach the complaint one by one. So the power of listening to the patient and repeating it. So this gives you time to think. While you're repeating the question, that gives you time to answer, time to plan your treatment. So impromptu skills of speaking. This size will fit all. You should learn to talk, think on your feet, be professional, be presentable, impressive, friendly, and have empathy and reassuring to the patient. So effective listening, quick thinking, logical thought, being in emotional control. Never, ever, ever lose your temper in front of the patient. What I do is, at times, if the patient really pushes me hard, I will excuse myself. I'll say, sir, just have a glass of water. I just will come in a minute. I will leave the room, go to my room, take 5 deep breaths, come back relaxed. Because some patients will actually push you down the corner. They will say nasty things to you. But the moment you utter something out of anger, this thing will spiral out. So retain your calm, retain your composure, be respectful, but be professional. Don't be trampled. So you can do all these things. A lot of times, the complaint is so obvious, but we are so caught up into a clinical jamboree. The patient is saying, okay, this has happened. I lost my husband last month. You have missed that. You're just concentrating on the complaint. So this lady probably has got some depression. She's sad. She needs extra 2 minutes. So say, okay, क्या हुआ? Just say, okay, uncle को क्या हो गया? Oh, I'm so sorry. अच्छा आप ऐसा करें, मैं भी आपका next appointment थोड़े समय बाद दे दूंगा. I will call you again. Show that compassion. And this patient is yours forever. Sometimes if you see there's somebody who was ill who's come with the lady, you can say, अच्छा last time वो आए थे, how is he? So a lot of times she'll say, oh, his leg got fractured. So this lets the patient know that the person is a human being and you know their world. So how to deal with a complaint? First of all, whenever you have a complaint coming in your face, relax. Be level-headed. Acknowledge all the grievance. It's never a wrong thing to say, yes, I understand you're upset. Most of the times as a doctor, we become defensive. The patient will say, this has happened. So even if you repeat it, it doesn't mean you agreed. What you can say is, yes, ma'am, आपने सोचा, आपको लग रहा है कि ऑपरेशन खराब हुआ है, आपको लग रहा है कि लेंस ठीक नहीं लगा, ये आपका लगना सही है, पर वो truth नहीं है. Anyway, let me explain it to you. So when you acknowledge what they are saying and you don't deny it, they feel being heard. Half the problem is over. So remaining calm, listening to grievances, don't interrupt. And as I said, the golden word is ask the patient, how do you think I can help you now? 90% of the patients will tell you what they want. Do that and the unhappiness is gone. Another good thing is to have happy staff, smiling staff. Hello ma'am, good morning ma'am, ram ram. If the staff is having an happy environment, any angry patient who walks in from home thinking that he'll shoot you with a AK-47, by the time he sits for half an hour before he sees you, he sees happy patients, happy crowd, he's lost his AK-47. Believe me, have a happy environment. If the patient is appearing sad, acknowledge their feelings. Sometimes they have some personal issues which are going on at home. Listen to them. Give it 2 minutes and then start your medical practice. So if you just reassure the patient, so many times I just say, ma'am, I'm here. There is nothing which is going to go wrong with your eye. I'm there to take care of it. Relax. Everything is fine. This one sentence is powerful enough to send the patient home. Sometimes a simple thing of watering to an old lady can mean that she's afraid she will lose her eyesight. If you just say, ma'am, this is simple watering, we will take care of it, but I can assure you, your vision is not going anywhere. The whole team is here to help you. That's what she wants to hear. Suddenly she becomes happy. So once you have a complaint, what to do that? There should be an action protocol. There should be an organogram displayed in your clinic that what to do, whom to talk, who is the manager, who will take care of the complaints. There should be a flow chart displayed in the clinic. What level, what manager, how the complaint is escalated. Make sure that the patient is informed that the complaint is noted, being acted upon, and completed. These 3 things will make the patient happy. First of all, if there is a complaint, make sure it is noted. Give a copy to the patient of the complaint. And please, when the action is going on, somebody from your team should call up the patient and say, ma'am, you complained that day, we are working on it. It's a very good idea, what you gave us, we are working on it. And once the complaint is totally taken care of, inform the patient. This completes the loop. There should be a protocol. No complaint should be destroyed or hidden from the management. If there is a complaint, it has to be escalated. The top person or your quality manager or your floor manager or your center manager should be there to take care of it. Every Saturday, I get all the complaints. What are the action taken? There's an ATR, action taken report. There's a KAPUR, curative action, preventive action. What has been done and what will be done in future that shouldn't happen. Suppose somebody slipped from the stairs, there will be an ATR, there will be a kappa. What has to be done? So, and once this is done, the person who's complained has to be informed that this was your complaint, we've acted upon it. Now this patient will go to the market and tell 10 people that this is the organization he came for. So unhappy patients a lot of times will give you insights into your organization. They'll tell you how to improve your organization. So don't be always deaf to them ki ye to sirf aise hi bol rahe. Look beyond their upset. A lot of time they are giving you golden pearls, how to improve your practice. Have a team which is goal oriented. The goal should be, at Sharpsight we say, we don't want happy patients. We want delighted patients. Is it true? We just say we want delighted patients. And how do you get delighted patients? When your team and fellow workmates are delighted. You cannot have delighted patients if your teammates are not delighted. If my doctors, if my managers, if my optoms, if my front desk, if my marketing team is not delighted, they cannot give the delight to the patient. Documentation of any complaint is very, very important. Use social media tools, photographs, images to tell the patient so that all the queries are answered. Always encourage a second opinion. If you feel the patient is really unhappy, document it that you asked for a second opinion. This lets the patient know that yes, you are confident of what you've done. 90% of the times the patient will not take a second opinion. But the very fact that you offered to have, for him to have a second opinion, lets him know that you stand tall in what you've done. Always show compassion, but please maintain your dignity. Do not lie down on the ground and don't let the patient walk over you. There's a very fine line. You can do that. You can be gentle, you can be, firm, you could be compassionate, you could be professional, but yet not let the patient walk away with your dignity. Kindly discuss unhappy patients with your fellow colleagues. A lot of times you'll get an insight. What is going wrong? What is to be done? Discuss the cases. A lot of times we cross-discuss within our team. So always when the issue is given a closure, communicate with the patient that day you give us an idea, that day you had an issue. I hope it is taken care of. I hope we see you next time. When you come back next time, that issue is taken care of. So that's what happens. So happy patients will give you more patients, which of course makes you very happy. Thank you.